I'm Dr. John Torquato, and this is Preventing Diabetes. Welcome to this series on preventing diabetes. The information presented here follows guidelines that are set by government and leading health experts. Its purpose is to help healthy individuals remain free of diabetes. People with existing diabetes can also find this information helpful, but they should talk to their doctor for personalized advice on how to manage their condition. This presentation is divided into short sections that will make it easier to learn and to apply the information. And today, in Section 1, we will discuss facts about diabetes and how it can affect our world. Diabetes is a significant concern in today's world, and its prevalence is just increasing. You might know somebody who has this condition, or you might even be dealing with it yourself. In this section, we're going to cover the prevalence of diabetes and how it increases mortality rates. We're also going to look at some basic causes of the disease. Diabetes is quickly becoming a top health concern in our nation. While other major health problems such as stroke and heart disease are dropping, the rate for diabetes continues to climb every year. For example, 1.2 million people are newly diagnosed with diabetes every single year. Diabetes has been increasing approximately 14% ever since 2012. The total cost for diagnosed diabetes in the United States in 2022 was $412.9 billion. And diabetes is now the 8th leading cause of death in all of the United States. From these statistics, we can see that diabetes is a major health problem that needs more attention if we're going to slow its current rate of growth. Here's a few more statistics showing how prevalent diabetes is today and how common it's going to be in the future. In 2021, 38.4 million Americans, or approximately 11.6% of the entire population, had diabetes. Out of the 38.4 million Americans, only approximately 2 million had type 1 diabetes. In that same year, 97.6 million Americans aged 18 and older had pre-diabetes. If we were to break it down further, of those who were born since 2000, there's a 33% lifetime risk for men to develop diabetes. For women, it's a 38% lifetime risk to develop diabetes. And for Hispanics, it's a 45 to 50% lifetime risk of developing diabetes for those born since 2000. We're also seeing a decreased life expectancy in people that are diagnosed with diabetes at age 40. For instance, in men, generally they will live 11.6 fewer years if they're diagnosed with diabetes at age 40. For women, it's 14.3 fewer years of life for those diagnosed with diabetes at age 40. And not just fewer years of life, but in total, there's a 20-year decrease in healthy years while they are alive for those that are diagnosed with diabetes at age 40. Now you'll see on this slide that there are some sections that are highlighted in yellow highlighter. Wherever you see yellow highlighter, you know that we're going to ask a question in the next slide or two about that yellow highlighted area. So you should take special notice of the area that is highlighted in yellow. For instance, this section talks about decreased life expectancy in people who are diagnosed at age 40. And you'll see below that there's a section that says there's 20 years decrease in healthy years. So pay attention to the areas highlighted in yellow because we're going to ask questions about them. In fact, let's do that now. Here's a question. A person who is diagnosed with diabetes at age 40 will lose how many healthy years of life? Is it A, 1 year? Is it B, 20 years? Is it C, 50 years? Or is it D, 75 years? After we ask the question, we'll ask that you commit to your answers and write them down. After we've given you a few seconds, we'll give you a little bell sound. When you hear that sound, that means we're going to change the slide and give you the answer. So you should put down your pencil and prepare to see the answers. So, now that you had the question asked of you, a person who is diagnosed with diabetes at age 40 will lose how many healthy years of life? The answer is B, 20 years of healthy life lost for those diagnosed with diabetes at age 40. I'm Dr. John Torquato, and this is Preventing Diabetes.